Fox 5 News, this is Good Day New York.
A huge snowstorm like the one that hit us over the weekend comes a lot of injuries. In fact, experts say most of the injuries actually occur days after a heavy snowfall when people start to go out onto the roads. They walk, it's all slippery.
You see what they're doing right there, removing snow? This can be dangerous, actually dangerous. Dr. Rahul Sharma is an emergency room doctor at New York Presbyterian Weill Cornell Medical Center. Welcome to the show, sir.
Thank you.
Before we ask you about what you're going to see in the ER today, I want to ask you about what you saw in your neighborhood in terms of snow. Where do you live?
I live near Murray Hill.
Murray Hill in the 30s, on the east
30s,
side.
Yeah.
How was the snow removal efforts by the city in your neighborhood?
I think there was a lot of snow on the ground.
It's weird this time, right? Kind of slow.
Yeah.
All right, what are you expecting to see in the ER today?
Well, typically after any snowstorm, the day after, usually the ER is pretty much packed with snow-related injuries. People fall, people get injured, and also people that usually would have came in the day before with regular medical problems not related to snow also present. So we're expecting a pretty high volume today in the emergency department.
Okay, what kinds of things do you see? Obviously, people slipping, but you were also telling me that shoveling snow, and Greg mentioned this as well, it can be dangerous.
Absolutely. So shoveling snow could actually put a stress on your heart, and people with any underlying medical conditions, heart conditions, with diabetes, hypertension should pretty much not be shoveling. If other people are shoveling, just go out, stretch, just like you're going in for a workout. Not working out and going in and shoveling and trying to lift snow is going to end up giving you back strains or different pain.
Or hire some 15-year-old kid
Exactly.
to snow for you. I did it on 3rd Street in Garden City. I made a lot of money doing it that way, and I
Listen,
appreciate what.
I don't know how many years ago that was. You can't find kids to do it anymore.
What? They don't want money?
They don't want the money. I guess they're getting it somewhere else.
Kids
It's
still like
impossible.
money. Doctor, what about heart attacks? You see that, right?
Well, certainly whenever when you're shoveling, you're putting a stress on your heart. So if you have any risk factors, if you've had a previous heart attack, you have hypertension, by shoveling, you're essentially going to be putting stress on your heart. So I would recommend anyone with any underlying medical problems to really avoid shoveling. That's probably my biggest recommendation.
What about frostbite? I mean, you figure, oh, it's cold, but this is New York City. People really don't expect to get it. But I have to say, I know kids hate putting on the gloves. They like to take off all their stuff.
They're lazy and they don't want to wear gloves.
Right.
I'm just saying, kids do not come to knock on our door to shovel anymore.
That's
I wish
too bad.
They would. I wish they would.
No,
Yeah.
that's
so
a
frostbite.
That's a great
yeah.
point, especially now, people going in Central Park, going sleigh riding. Just make sure your kids are dressed warm, make sure they have gloves on, protect themselves, because even a few minutes exposure could result in frostbite, especially in the snow.
So even if you're just out having fun, you could run into some trouble.
Yes, absolutely.
How much busier are you going to be today than you are, say, on a typical, Tuesday in December without snow? Snow-free Tuesday.
So today's Tuesday is probably really a Monday. Usually, typically after a Christmas holiday, we're usually very busy. So yesterday, I think a lot of patients weren't able to come. But today, I think, in addition to those patients, the snow-related injuries, the fractures, the falls, the contusions, I'm expecting a pretty busy day.
All right, so one more thing. If your hands get really numb, because my hands get freezing, you're supposed to warm them in hot water as soon as you get home, or do something more slow?
Rapid rewarming, I wouldn't put them in hot water. I think you're going to end up with more complications. But, lukewarm water is probably the best way to go.
All right, thank you, doctor.
Great.
All right, I've got a couple other medical questions for you.
Okay, we'll talk later.
Not cold related. Yeah, in the commercial break. Do you mind?
Yeah, sure.
All right, cool. Free medical help. Dr. Rahul Sharma from New York Presbyterian.
Weill Cornell Medical Center.
Thank you so much. One more piece of advice, important advice that I've been following for a long time myself. Tell us, doctor, backseat of a taxi cab, what are you supposed to do? What do most people not do?
Well, I would say, Greg, put your seatbelt on. Especially right now, everybody wants to take cabs to try to get to their places quicker. And that's probably one of the most common accidents we see in the emergency department is people not putting their seatbelts on, especially during slick conditions right now. On my way here, I saw 2 cabs sliding as well. So please put your seatbelt on. It's going to really prevent a visit to the emergency department.
And again, in the back seat of a cab, there's this tendency to think, oh, I'm in the back seat. These front seats will protect me somehow. Not true.
So you really do buckle up in the back?
I do. I've been doing it for about 2 years.
I do too. It's like a major nerd cred, but
exactly.
I do it. Everyone's like, "What are you doing?"
Your co-passengers look at you funny, but you don't want to have that credit card machine implanted in your face.
Look at that. Let's ride together. We'll have the whole, "Hey, Greg," because we can't sit close to each other.